Aboriginal and Torres Strait Islander women are 2.5 times more likely to be diagnosed with and 3.8 times more likely to die from cervical cancer than non-Indigenous women. Denisha is only 21 years old and she was diagnosed with stage 2 cervical cancer last year.
So some days I wake up, it's totally fine, but then there are other days where I'm in so much pain. So the day that I found out that I had it, it was just like a normal morning. I got ready my son, took him to school, and then I got to work and I couldn't even walk. Like I got out of the car and I was like, yeah, no, like I can't work today. I'm in so much pain. And then I went for a pap smear and then it just happened from there.
Cervical cancer occurs in the cells of the cervix, the lower part of the uterus. Almost 80% of cervical cancer occurs in women who have never been screened or are not up to date with their cervical screening.
Yeah, no, so I'm really bad. Like that was my first pap smear that I've ever had. And luckily that I did go when I did, because probably would have never have gone.
I spoke with Professor Kate White, cancer nursing professor at the Chris O'Brien Lifehouse.
The Indigenous population are more vulnerable, and certainly for young women, cervical cancer is one that we are very concerned about. And whilst in our non-Indigenous population overall we're doing much better, we're not seeing the same success yet in our Indigenous population.
Cancer Australia released a handbook in March 2018 for Aboriginal and Torres Strait Islander healthcare workers to help women be proactive about screening for gynaecological cancers. Cancer Australia were contacted for further comment but did not want an interview.
It's a really important resource for Indigenous healthcare workers that enables them to, in their community, take that information and run education programs and to help break down some of the terminology, some of the barriers to participating in screening. But the next thing is about the screening previously involved a pap smear. It's very intimidating to go to a healthcare centre and have a pap smear because it's invasive.
It should start with educating young women during high school about getting regular cervical screenings to detect gynaecological cancers.
I think that, well, to be honest, like just looking back at like leaving high school and everything, like you don't really get educated about that stuff. And I mean, my mum and dad don't really talk to me about that stuff.
So with cervical cancer, our approach is twofold. One is through screening. Historically has been a pap smear, but we've got a slightly better test now. And the other way is through the immunisation with the HPV vaccine, which has been targeted at teenagers. So both of those areas are really important for Indigenous population because their understanding of why their daughters and sons should be immunised and why it's important to have that as far as prevention, okay, because that's what we're trying to do, is really important.
As of last year, the cervical cancer screening has changed from every 2 years to every 5 years, making it more accurate, less often. Don't be ashamed, go and get tested.